Gone are the days of simple A, B, C, D. The NGN has completely changed the game when it comes to question types. From Bowtie, select all that apply, case studies. Today, we are breaking down the types of questions format-wise you'll see on the NCLEX and how to conquer them. This is the Nursing Navigator.
Nursing Navigator's here. Wipe away those study tears. Hurst, reviews got your back. Listen close, stay on track.
Have you been on TikTok lately?
Girl, yes.
Have you seen that trend? It's like on the floor and, well, I'll just play the sound and you'll probably know what I'm talking about.
Cheesecake. Apple pie. Chocolate chip cookies.
Yeah,
Brownies.
that one.
Yeah.
Okay, so it gave me some inspiration for today's episode. Instead of talking about desserts and how much we open our mouth because we like the dessert, let's talk about the types of questions that people can anticipate to find on the Next Gen NCLEX.
Oh, yeah. And they're not going to open their mouth for any of them because they're not going to like any of them.
But we know that there's quite a few. I mean, I think everybody immediately is like, oh, the select all that apply or the, multiple choice. But really, I mean, those are the two that I'm most familiar with just from, scrolling and seeing the practice questions. But there's a lot more to it. And I'm hoping as my co-pilot today, you can help us break that down a little bit further.
Absolutely. So the two question types that you just mentioned, you mentioned select all that apply and multiple choice. Those, of course, are the most common question type. Most people have practiced those before, but there are some other ones that fall into that category too, and those are considered to be the traditional standalone question. So I think maybe how we start is we first just talk about the different categories of questions that we could see.
That sounds like a wonderful starting point.
Right.
So let's lay the foundation. We have categories. How many categories are there?
Well, there really are three different categories that your questions could fall into.
And the first one?
Is traditional standalone. So you got your select all that apply, and then you got your multiple choice. But you also have your drag and drop, your hotspot, and your fill in the blank.
Fill in the blank. So that's a total of 5 question types that fall into category number 1.
That's right.
We'll get into those 5 here in a minute.
Yep.
I want to move from category 1 to category 2.
Yep.
And I'm not talking about weather.
No. Well, it might feel that way. It might feel like a cat 2 versus a cat 4. Yeah. And most people probably say, no, we're jumping straight to cat 5 with this.
Oh,
it's
yeah.
bad. But the next category would be considered your case studies, which are your NGN format questions.
Oh, yeah. And I know that those really can kind of make people shake in their boots.
And I think one of the biggest issues with a case study is that the question type or the format changes throughout the case study. So there are multiple different question types you could see in a case study.
So do those question types that people can expect in a case study come from category 1?
No, they are different question types. And I think that's what causes some of those feelings of anxiety or pressure when students are taking their NCLEX, because in some situations we've asked students, well, have you practiced this question type before? And they're like, what is that? I've not seen that. They're like, I've seen a case study, but not that particular question type. So we've got a list of those. You've got things like your extended multiple response, which is basically an extended select all that apply. You have your Cloze question type. You have
Cloze.
Yeah, C.
Like what you were wearing or CLOSE?
Okay, so CLOZE, Cloze.
Cloze.
Yeah.
Does that stand for something?
No.
Oh, okay.
Or if it does, I don't
Cloze.
really know. I don't really know.
We can make
Cloze.
it Francais.
It's very French. But with these different question types, that can get very, frustrating because if you've not seen them, if you've not practiced them, then you're not very comfortable with them. And there are a lot more. And we're going to jump into like each one and individually talk about what to look for and how to answer those.
Okay. Category 1, category 2, case studies. there's one more category.
That's right. And so for your category 3, you've got these things that they called clinical judgment standalone questions, which sometimes you might hear people just refer to them as CJ standalone questions. And the issue with CJ standalone questions is that they appear to be in case study format. But instead of having that 6-question unfolding case study, it's just one question.
It's in disguise.
It really feels like a disguise. And again, because those questions are typically higher difficulty level and they're asking you so many different things, they present you with a lot of different information. Those can be a little bit more anxiety producing. And so for those, you have 2 question types or question formats. You have the Bowtie and you have the trend question type.
Bowtie and trend fall under the clinical judgment category, in this case, number 3.
That's right.
Okay. So I think that helps with the foundational aspect of it, but we're not done.
No.
That's not today's end of the podcast.
No, we really need to dive deeper into this and really talk about each question type and what are some rules or strategies, because, strategies are really helpful.
Yeah, we love strategies.
Yes.
So let's start with category 1. We'll break that down even further. Yep. And those are what we refer to as standalone. Mm-hmm. The first one that you mentioned is just, multiple choice, but not ABCD, as you might be more familiar with from earlier education and maybe even nursing school. But ABCD translate to 1, 2, 3, 4.
That's right.
On the NCLEX.
Yep. And so what's actually kind of funny about the multiple choice question is that some people have gotten so used to the letters, like the ABCD, that even when they see that question with the numerical values listed, they will still correspond it to a letter. 1, A, 2, B, 3, right. C. And we're like, there's no letters. There's not going to be any letters on the NCLEX. And at least you don't have to, type that out. You're just going to click. But when it comes to a multiple choice question, I think if you asked, nursing students and, we want to know, like, is this your favorite type of question? Is that most nursing students would tell you multiple choice. Multiple choice is my favorite type. And the reason why they're a lot more comfortable with multiple choice is because a multiple choice question, there's only 4 options to choose from. And out of those 4 options, only one of them can be correct. And I think the funny thing about when you ask nursing students about the multiple choice as well is that they say, well, the teacher said most correct. Instead of being like, it's actually the real answer. Out of the 4 options, it's the one that's the most correct.
That can trip you up. It is a little tricky. But at least statistically speaking, you have a 1 in 4 shot of getting it right. If we are just shooting blind here.
That's right.
But we're not, because you talked about some strategies. Mm-hmm. What is a good strategy when it comes to a multiple choice NCLEX question?
Well, a lot of students play the game of trying to narrow it down to 2 options. So if you can at least get rid of 2 options that you're, sure or pretty sure that are not the correct answers.
Or the most correct.
That's right, or the most correct. Then you've only got 2 options to choose from after that. And then that just gives you, a higher probability of getting the question right. Another thing is to know your content. Is that if you really don't know what the NCLEX is asking you to begin with, or if you're off on your content track, then you're going to be off on your answer track. So really know that content, use the narrow down strategy, and then, find out what they've asked you to do in the question. If they're asking you for an intervention, like something you would do, then you want to do the thing that's safe. Okay? You want to do the safest thing. Or if they're asking you another strategy for this is if they also ask you, what are you doing? You want to pick the thing that fixes the issue that the client has. So fix the problem.
Fix the problem.
That's right. It's my favorite. It's one of my favorite ones is fix it. A lot of times students don't try to fix it. They try to get more information. Or they try to show the NCLEX people how much they know. And we're like, they don't want to know that. They want you to take what you already know and use that to help the client. So just fix it. And then another really good strategy here is assume the worst. Assume the worst about what they've given you instead of thinking that it's not that bad. So whatever scenario you see up there, it's bad. And it's the worst thing you could possibly think when you see it.
And we're assuming the worst, fix the problem, and keep the patient safe.
That's right.
So you mentioned knowing the core content. Mm-hmm. And maybe if you're able to eliminate two options that you know are not the best answer, the safest answer, if you narrow it down between one of two options, we got a 50-50 chance, and you understand the core content, I think some of the strategies that we reinforce in our curriculum and in the way that we teach students to study and prepare for the NCLEX is to, be able to think through. If you understand the core content and the fundamentals of it, then, you can work your way to the safe answer that fixes the problem and keeps the patient safe. And when you're studying, talk out loud. Talk through it. When you're at the testing center, maybe don't do that.
Not out loud anyway. In your head is fine.
In your
Not
head.
out loud.
but really kind of walk yourself through those scenarios in order to get you to the best option.
For sure.
And in the multiple choice, I've seen, what is these letters in bold, or sentences in bold. So tell me a little bit more when it comes to these multiple choice questions, what it can be asking in those bold letters.
Right. And so most of the time, if you see a bold word, it's going to say something like most or first, best, initial, immediately, priority. And a lot of times students, when they see those bold words, they try to play the game of, well, first means first and most means most, and what, trying to differentiate between what the words mean. But there's a better strategy for that, is that it does not matter what the bold word is. You're going to say, this is important. And they've only given me 4 options to choose from. Only one can be right. So I need to pick the one thing that either fixes the problem that I have, or it needs to be the one thing that's the killer answer. Like, what's the worst thing that I can possibly see here? And I need to pick the thing that would harm my client so I can keep them safe. And so there's a strategy to those bold words, because that makes it a priority style question.
So we'll see them on the multiple choice, but I know that we also can see them on select all that apply.
That's
or
right.
SATA. Do people actually say that?
SATA.
SATA.
Yep.
SATA.
SATA. And I mean, sometimes people just say that because it's just quicker than saying select all that apply. And not to be, confused, is that this was one of those questions that has multiple names. And so you might see this referred to as the multiple response question, but it's still just a select all that apply question.
I feel like I've seen some examples to where that can be a little misleading, because the tricky little NCLEX people love to trip you up sometimes. And in a select all that apply, only one of the several options that they list there could be there. And it's like, well, why wouldn't that be a multiple choice question? It's because of those tricky little NCLEX questions, but you listen to the Nursing Navigator and you know how to respond.
That's right. And I think that's one of the reasons. It's not the only reason, but it's definitely one of the reasons why students dread this question. I think if you ask them what's their least favorite question, this is on their list. It might not be number one.
They're not opening their mouth when we say select all that apply, or jumping up real high. However, I've seen so many versions of the trend.
I know.
Like the people who sleep and they're like, what fast food would I wake up for? And it's like Chick-fil-A. I'm out of bed and in the car.
I'm gone. I'm already in line.
Yeah. Burger King, not so much.
Same.
Yeah. So it could be one of the multiple. It could be all of the options. So this one, I can see why students really would have a lot of apprehension towards it.
That's right.
What are good tips or strategies when it comes to select all that apply questions?
All right. Well, first, if they understand the formatting, because outside of a case study, your select all that apply question can have 5 to 6 options. And you already talked about, it could be one, it could be all, it could be any number in between. That's correct. And so the NCSBN is not very clear, but they do have a statement that, there are no limitations to the number of options that can be correct or incorrect. And so they're not limited in the number that they can pick. And so another thing is they love the partial credit. We know that they do get partial credit for this type of question, but don't rely on it. Don't rely on the partial credit, because the scoring system is so varied. It depends on a multitude of factors. And so the more you learn how to fully get a select all that apply question fully right, then when you get one on the NCLEX, even if you don't get it fully right, you've practiced that so much, you know you're going to get partial credit at least.
So it's kind of like a love-hate relationship.
It is.
Like we love partial scoring.
Right.
But we also really hate the select all that apply questions.
That's right.
I guess there's good with the bad and bad with the good, just like with anything. So let's focus on the good, partial scoring.
Yeah. So with the select all that apply questions, along with the NGN-style questions that we're going to get into in just a little bit, the NCSBN awards you partial credit for that. And in the past, if you got any portion of any question wrong, it was just wrong. You got no credit for it. But now students get, awarded partial credit. And so the partial credit scoring system is based on lots of factors. So you have to consider, what is the level of difficulty of the question?
Which they don't tell you.
Right. They don't tell you. And I will tell you, this is a really good, strategy, is don't go into the question thinking that you understand the level of difficulty, because the question type does not determine the level of difficulty. So people sometimes think, oh, it's a multiple choice question. That is a little bit easier. I do know how to answer it, but that automatically makes it a lower level question. That's not true. Your multiple choice, your select all that apply, any other question type can be any level of difficulty.
Across the board.
Across the board.
That's helpful. And I know we always say, and we've said it in previous episodes, don't try to analyze the test. Let the test analyze you.
Yep.
I think that's wonderful reminder as you're in there. Just, take each question, one question at a time, and know that it could be a higher weight because it's more challenging and difficult. Or, for the select all that apply, we always say trust your gut too. Yeah. So if you know only one of those options is correct, and you know that core content, and you've thought through the scenarios, and you've kind of assumed the worst in every situation, and don't second guess yourself.
That's right.
Because you could get full credit if that one answer is correct. You could get full credit for that question. But if you start saying, are those tricky little NCLEX people playing games on me? And you select another option just because you're not sure, then we're getting into a partial credit situation to where you're not getting full credit for it.
Right. And even though the partial credit scoring system is good, you also have to think about the fact that the scoring that you get is based on, how many of the options were right and how many did I pick? Or how many options were incorrect and how many did I pick? And so we're playing that game there. And the issue with that is that the more you rely on partial credit, most likely the more questions you're going to have to take. And then the more questions you have to take, that starts triggering that whole test anxiety thing that we all can have. And, once that's triggered, we have to find a way to stop that, but once it's triggered, it's really hard to stop.
Yeah.
And so we don't want to fall into that cycle. The more we're getting full credit, the less questions we have to take.
And we talked about, pressing the reset button. And if you have to take more questions, more than the minimum of 85, it's overtime. We're still in the game. We're still, have that chance. We haven't passed yet. We haven't failed yet. And there's an entire episode on that you can go back and listen to. Right. But the majority of students, they don't want to go into that overtime session. So we're really kind of focusing on answering accurately and meeting whatever that standard is for the select all that apply.
That's right. A few other strategies. Look at each option as a standalone option. So do not try to tie option 1 with option 2. They're by themselves. And then when you look at each option by itself, you just play the true versus false game. Is this true? I pick it. If it's false, leave it off. But that goes back into knowing your core content. Because if you do not know your content well, how can you tell if it's true or not? That's about knowing. Because if you don't know, you're guessing at that point.
I feel like we're going to see common themes throughout this.
Oh, for sure. For sure.
So that, I think, covers the two most common standalones. But we know that there's 3 more as you laid out for the first category. So the next one would be fill in the blank.
Yes. And I know that kind of is anxiety inducing at that moment because people think, oh, fill in the blank. I've got to know some words to put or essay to write in the blank. And
It
we're
reminds me of like
no.
Mad Libs. Did you ever play
Yes,
those?
I love that.
Where it would ask for like a noun or I was always bad with parts of speech.
Me too. Like, wait, I don't remember
What's
what
an
an
adverb?
adjective.
Yeah.
Yeah.
So we're not talking that kind
No.
of fill in the blank here.
No. And so this is just calculation style questions, typically for pharmacology, like if you have to calculate a dosage. But it could also be other types of calculation, like figuring out weights or calculating INO,
What's I know?
intake and output.
Okay. That was not one of the ones that we went over on the language of nursing.
It's not.
So that's why I had to ask.
Extra points here.
Continue.
And so with this, sometimes, students don't report that they feel like they got a lot of these. And again, we don't want you sitting there trying to figure out exactly how many of each question type you got, but you might not get that many of these. Some students say they didn't get any. And so we still want you, though, to practice your calculation questions because you might get those on the NCLEX. And so the thing to remember about this is that the only thing that goes in the blank is a number. So you don't have to have the unit of measure at the end. And I know that for some people, especially me, I'm having flashbacks right now and I'm sweating thinking about it, is that my teachers made me put the unit of measure after my answer. And it was wrong.
Like milliliters?
Yes.
Or, yeah.
Yes.
Okay.
So like milliliters or, drops or anything like that. And it was just wrong if you didn't put the unit of measure. And I was like, but it's right. The number is right. And they're like, it's not right unless you have that unit. And we're like, okay, great. So if that's you, like if you've had teachers that were doing that, of course, do that for them. But please know on the NCLEX, you do not have to do that. Please don't put anything else. Because if you put anything else in the blank, it'll give you a warning. Like it won't just take it, which is good because it's kind of like a safety built in. It won't just accept your answer and then say it was wrong. It'll basically give you a warning that there's something else in the blank other than numbers. So you just need to get rid of that.
And that could increase anxiety. If I saw a
for
warning pop
sure.
up, I'd be like, what's going
Oh,
on?
no.
So that's good to know. And like you said with your teachers saying, you have to put in the unit of measure. What a wonderful, yet again, reminder that the NCLEX is unlike any other exam that you've taken in nursing school. This is a safety test. And I know we say that all the time, but it really does require you to think differently. And we don't want you to analyze the test, but we want you to understand it. And that's why we're putting out episodes like this. So that way, like Ashley said, you may find a fill in the blank when you sit to take the NCLEX. You may not. Right. But at least now going into it what you can expect. Yep. And that also explains why there's always that little calculator button up there. I'm like, are we doing math in here? What's going on? And
sometimes students have wondered, why is there a calculator? This is why it's there, because you could get this type of question. And so just an extra little strategy here for these types of questions. Your teacher probably told you this one too in nursing school, round at the end. If you have to, because some don't require you to do any rounding. But if you round, do not round until the very end when you get to your end answer.
So with rounding, are we talking decimals here?
Yes.
So it can be a number with when you put the period in for a decimal, it's not going to give you that warning.
No, it won't give you the warning for that, but it will give you warning for letters. Okay, so any kind of words or letters that you place in the blank, it's going to be like, no, that's not a numerical value.
Will it tell you to round to the nearest 10th?
Yeah, it will be specific. If there's something like that, if we need anything like that, then yes, it will tell you exactly where to round to.
And round at the end.
And round at the end. Only at the end.
So that covers 3. Multiple choice, select all that apply, fill in the blank. And this leads us to hotspot, which my dog gets those all the time. I know that we are not talking about hot spots that dogs get. We are talking about hot spot questions on the NCLEX.
I know it. These are actually kind of fun. Students don't like them. Again, there's no question type I think students just love. But when it comes to the hotspot question, you might not get very many of these either. But it's typically a diagram or a picture. And they want you to click where you find something or click where there's a problem. And so you have to actually find the location on the diagram that they give you and just click.
So when you say it like that, I'm thinking anatomy, like where is the tibia?
Yeah.
I'm assuming that is, I know that this is not where it goes to.
No.
It is still a scenario,
Yes.
a patient scenario
Mm-hmm.
that they're giving you information on, and you have to locate on the body, for example, where it could be stemming from.
That's right.
Is it only where it stems from?
It could be anything. They can ask you, and again, the NCLEX, they love to do things like this. They quote, they reserve the right to ask you anything in any way. So you kind of have to be prepared for all situations and scenarios.
Some attorney wrote that.
No,
That is
it
just
is very legal jargon.
Yeah, let's just cover all the bases.
Legalese here.
Yeah.
But it is always scenario based. And so instead of, because, again, they're not just trying to find out what you know. And so it would be nice, right? It would be nice if it was something that simple where they tell you exactly what they are looking for and then you just go click it. They may give you a scenario where they tell you lab values like ALT, AST, and they say those are elevated. Click where that is found. So you have to know that those are liver labs, right? And so because those are liver labs, I would need to click on the liver. And so it's going to say, well, where's your liver? Now, it might not have a liver picture, right? And so you're just clicking on the general area where the liver is found. But yeah, it's anything.
This whole time I'm thinking, where is the liver? Is it like right here?
It's in the
That's your
right
kidneys?
upper quadrant. Your
Right.
back's on the those are your kidneys. On
Those
your
are
back.
kidneys.
Yeah. Okay, so your liver is in your right upper quadrant of your
Right
abdomen.
upper. So like in
Yep.
here-ish. Okay.
Yeah. Yeah. Where's your liver? That's all I can hear. I can hear Marlene right now on our content saying, "Where's your liver?"
Where's your liver? And that leads us to our last one.
Yeah.
What's the last one?
Drag and drop.
Drag and drop.
It sounds like a dance move
Oh yeah.
a little bit.
Yeah. I love it. Drag and drop. Is this one where like students like they're waking up, they're opening their mouth wide when it comes to the TikTok trend, or are they just kind of still over there like?
No, this one again, it's kind of in the middle maybe.
Okay.
They don't typically hate this question, but they don't always love it. There are some things about it that are helpful though. So with this one, sometimes they may hear it referred to as ordered response. And so that just means you're putting things in order.
Okay.
So-
Similar to like a priority.
Yes.
Yeah.
Okay. And so what they could ask you is they could ask you the steps of a procedure, give you some steps, and then your goal is to put those in the correct order. Or they could give you a list of patients and ask you to place them in the priority order that they need to be seen. And so, of course, you would have to, place them in the correct order. And so some strategies for this one is just make sure you use all the options that
Don't
they
leave
give you.
any
Right, don't leave
on
any
the
out.
other side.
There's nothing else to consider about the options. I've seen students sometimes want to question the options. And it's like there's nothing to question about the options. They told you the options the way that you need to see them. You just have to put them in the right order.
Would this also apply to partial scoring? Like
No.
if you get like the first like two, but
No.
Okay, no
This
partial
is
scoring
wrong.
here.
Yeah, this is a situation where it's just incorrect. Because if you do this in the wrong order, it's wrong. There's no way to give you truly any partial credit for that. It would just be wrong. Because
Okay.
once you make a mistake in any of the order, the whole rest of every step from that following would be incorrect.
Oh, okay.
Yeah. So yeah, no partial credit
No
for
partial
this one.
credit.
No.
All right. Well, I'm feeling a little bit more confident when it comes to understanding the standalone category 1 question types. That leads us to our category 2,
Yeah, storm time, huh?
case studies, which you already mentioned that, you can see multiple choice or select all that apply,
Yeah.
but it's kind of a little bit different.
Yeah, they're a little bit different.
So tell me, starting with case studies.
All right, so with case studies, you're going to get 3, and those 3 are going to be scored. But the terminology here is that they say 3 scored case studies, meaning not only 3. So some people say that, oh, I got a 4th or 5th case study. Well, if that's the case, then what you can know right away is that only 3 of the ones that you got counted. And each of those case studies have 6 questions in them.
So if we know for a fact you're going to have 3, and we know for a fact that each case study has 6 questions, and we know for a fact that 18, is that right?
Yeah,
3,
that's
6,
correct.
12, 18. I'm not very good at math.
It's okay.
That 18 questions
Mhm.
will be case study related. Could be
Right.
more, but it's not going to be less.
That's right. And those would have counted. And people, again, that builds up that anxiety, but it's a knowing. It's at least going into the test knowing that the education part and just understanding and having an awareness of what something is going to look like reduces anxiety.
Oh, yeah, that's so important. Nobody likes surprises.
No, and that's the great thing about, listening to the Nursing Navigator is you're going to go in knowing, like, hey, case studies, I'm getting 3. Those count. If I get more than 3, something didn't count, And so we just...
But with that, if the 4th one comes, don't just start clicking because you
That's
know
right.
that it doesn't count. That is a really bad strategy.
That is right.
Do not do that. Take it again because, maybe the first one or the second one, you don't know the order. Again,
Right.
we are not here to analyze the test. You take every single question like it applies to your final score to help you kind of land above that passing standard line.
Exactly.
So if and when that 4th case study or 5th case study comes, take it seriously.
That's right. Well, with the case studies, there's another strategy that's very helpful, is that you can go ahead and know that when the question number 1 pops up for a case study, each of the questions will follow a step of the clinical judgment measurement model. And if you've not seen that chart, it can be a little bit nerve-wracking to see.
It is daunting, but
Yeah.
Valerie walked me through it, and it really makes sense if you understand it and know the process.
That's right. And so it matches, a step in the nursing process, which is very helpful. We talk about the nursing process a lot in nursing school. But when that question number 1 pops up all the time with no fail, it is trying to see if you can recognize cues. And each question follows a step. And so I think that's helpful too, is that if you already know what it's going to be trying to find out from you, then that makes it easier for you to answer it correctly.
Mm-hmm.
Yeah.
We know that there's 6 questions within a case study. You talked about the first question. Does the next question build off of the first one? So let's say maybe I didn't understand those cues and I'm not sure if I actually got the first one right. I'm not feeling so confident. Does that mean like I'm just kind of womp for the next 5 because it's part of the same case study?
That's such a great question. And no, and I think that's the great thing about it is that, okay, if you miss question number 1, you still got a shot for the whole rest of the case study. It is unfolding, which means that they'll give you your client, whatever's going on with the client, and you'll have that one client that you're following for the whole time. Now, they may add something to that or add another client in with that, but you'll be following that same scenario the whole time. It'll unfold with things like maybe you didn't have a tab to look at in the first 2 questions, but now in the 3rd question, there's this new tab that popped up and there's some new information to consider. So you'll have to open that up. But if you don't get question number 1 right, you still have a shot. You could end up missing question number 3, but getting question 4, 5, and 6 correct. So, it doesn't take away your ability to still answer the rest of the questions.
I like how you said that. It's unfolding.
Mm-hmm.
So now that we know that it's unfolding, what types of questions can we see as it continues to unfold?
All right. So the first one is very similar to one we've already talked about. We've talked about our select all that apply questions or multiple response questions. And so this one is an extended multiple response question. And
I'm guessing that means more options than the 5 or 6 that
Exactly.
you mentioned for the standalone.
Exactly.
How many options are we talking here?
Up to 10.
Oh, Lordy. That's a lot.
And students panic. Oh, you should see, like, they have the deer in the headlights look. And I get that. You know, 5 to 6 options already to choose from was enough and a lot. But when you tell them it could be up to 10, then they really, really panic. But the best thing about this is that's the only thing that's changed. The rules that we've already talked about apply here. Is that you still treat each one like it's standalone, true versus false. You don't tie the answers together. It could be 1, it could be all, it could be any number in between. So you don't treat it any differently. It's just more options to choose from. That's it.
Okay. And sometimes more options is good.
Right. And partial credit.
And partial credit.
So that's it. That's the only difference is that it's just more options to choose from. That's all.
Hence why it's extended.
Exactly.
So as it continues to unfold, we can see the extended, select all that apply, or extended multiple response.
Yep.
What else?
Well, I think students actually like this one.
Finally.
Finally.
Finally. Here we go.
I think they do like this one. And they may not have practiced very many of these, but we want them to be aware that this could pop up. And they're going to rejoice when they see it because it's called a select N, as the letter N as in number. Meaning they're going to tell you exactly how many to pick.
Oh, yeah.
I know.
Yeah.
Isn't that great?
That's relieving.
Yes, it is. And I think that's why they like this because I think that when they see that, it's like, okay, it doesn't matter now how many options you've told me. I just have to pick 3, you know? And that makes it so much easier. Now, it doesn't mean that it's going to be just super easy to pick out what 3 there are, you know, that is correct, but at least you know how many. So with the select N, it could be, you know, very similar to any other question type where they're saying, hey, pick the 3 interventions that would help the client, or pick the 3 lab values that are abnormal, or anything like that. And so you just want to pick the exact number that they tell you.
I feel like I am going to share a strategy for this one.
I like
I'm going off the cuff
go.
here.
Go, Sarah. Let's go.
If I get halfway down the list and I've already picked my 3,
I know where you're going.
I am not pressing next.
Yes.
I am finishing that list because one could be more applicable. And then you're going to start going back. We don't want you to second guess, but we want you to be able to read through all of the options before making your decision. Because some you can rule out, and then some you can say, yeah, that one's definitely it.
Absolutely. That was wonderful.
Thank you.
Good job. Absolutely. Because, you know, we do that sometimes. And in certain situations, it's not an issue with second guessing. It is the fact that I didn't read all the options that were presented, and then I see something that I know is right. Oh, no, wait, that is absolutely right. And so then you weigh it out between what you already picked.
Mm-hmm.
Like, oh, I'm good now. I can change my answer and I'm good to go.
There we go.
Yes.
Now tell me where this Cloze or Cloze or however it was earlier when you spelled it out for me, Cloze.
That's right.
Where does this fall into the picture?
Okay, so this is considered just a drop down question. I don't know if our Cloze, you know, if we were speaking French, Cloze, question, if it stands for anything or not. But the drop down type of question, students don't mind this one either because they'll have basically a statement or 2 statements, and then it'll have whatever statement is there, and then it'll be this nice little drop down menu. And you click on the drop down menu and it gives you options. And you need to pick one option out of that drop down menu that fits correctly in that statement. And so you could have, you know, more than one drop down menu throughout the statement, but only one option or answer in each drop down would be correct.
So you know that N is going to be 1.
That's right. Just pick one and keep moving.
Pick one.
Yeah.
So drag and drop, different than drop down.
Yes.
All right, we're still in the case study question types.
That's right.
So, you know, hang with us. We've got a couple more to cover. The next one is
Matrix, also known as grid.
Matrix or grid.
Yep.
Tell us about it.
All right. So with the matrix question, this is where you have, you know, your scenario, but then you also have like this big chart. And this chart can have multiple rows or multiple columns. And they may, you know, each column or row will have a header. and it wants you to select which options they've given you on one side match correctly to whatever options or topics they've given you at the top. So, for example, and just to make this a little bit more clear.
I'm tracking like kind of an Excel sheet a little bit,
Sorta.
like where you got your
columns
on one side, rows on the other, and then information kind of filling up the rest of the square.
That's right. And so an example of this is that they could ask you which actions or which options would be shown as indicated, non-essential, or contraindicated. And so they give you all of your information about your client in the scenario, and then they'd have these actions or signs and symptoms that the client has. And so let's say over in the information that they've given you about the client, they've given you a temperature and a blood pressure and all these other vital signs. And then they give you interventions about those vital signs. And one of the interventions says something like administer acetaminophen for the client's temperature. Mm-hmm. Well, then you have to go back to the information they gave you and find the client's temperature. You'd have to ask yourself, would I give acetaminophen for the temperature that they have? And so you're going to either click that they are indicated essential or, contraindicated. And so you have to make that determination. And that means that you could get it right, could get it wrong. And there are some situations where you're going to pick more than one thing, just depending on what they asked.
In one question.
Right. And so it wouldn't be a situation where you're choosing if it's essential or not, but you could be tying signs and symptoms to disease processes.
This is really important to where, I know we keep saying it, but like understanding your core content.
That's right.
Because there's a lot of factors to consider. This one sounds like there's a lot of layers. I'm intimidated by this one. I'm not opening my mouth very wide or jumping up out of bed for this one.
Most students would not, again, because these can get very difficult. Again, level of difficulty thing. But the case study style questions are already so layered and so much information included that sometimes students really struggle with these.
You just mentioned level of difficulty.
Mm-hmm.
Is it, safe to say that certain question types, like maybe that extended, the extended select all that apply, or the matrix grid types tend to be more difficult than a standard multiple choice or select N, for example?
For sure. And it's almost safe to say that your case study questions are going to just be high level difficulty because the case studies are so robust. There's so much information to consider. And so, yeah, for sure. All right. Now, I know with that matrix or grid question, that one was a lot. It was a lot to unpack. Yeah. But the next one, I think students actually kind of like this one. This one's a lot more straightforward.
Okay. And this would be the last question type that we would see in a case study, right?
Yes, it is.
What is it?
Highlight.
Oh, highlight. Oh, yeah. Self-explanatory.
Yeah, it really is. And I think, nursing students have spent a lot of time highlighting. But they've highlighted a lot of non-essential information in that textbook. They just highlighted the whole paragraph, right? And so we need to get out of that practice because this question is going to ask you to be very specific and highlight what is most important. Highlight the indicators that we have an issue. Highlight the signs and symptoms that need follow-up. Highlight, vital signs that need a follow-up. Anything like that where you have got to choose what is most important versus just highlighting the whole thing.
I like this one.
Yes.
I'll jump up in the air for that one.
I know. I think they like this.
Yeah. So that concludes our case study. Mm-hmm. That's a lot. And again, we know that there's 6 questions and that you're going to get 3 at minimum. So it is intimidating. I mean, we hear that from students all the time, but it's important to practice those skill sets, understand your core content, and really, know what to expect. Because again, nobody really likes surprises. No. And it's safe to say that case studies require they are higher thinking.
They are.
And maybe more level of difficulty than your standalones. But the good news is that it's just 3.
Yay.
Just
that are scored.
Whew. All right, Ashley, we're cranking through this. Thank you
You're
for
welcome.
breaking these down a little bit more. That covers our first two categories, which means that we have one left, and that is our clinical judgment standalone, or CJ standalone. Since we're in nursing, we love to abbreviate everything to be easier.
Right. We like to be trendy.
Now, if you stuck with us this long, thank you. We are just wrapping this up here, and we're going to put a nice little bow on it. Thank you, bow ties. Let's get into bow ties.
Good.
Thank you.
You're welcome.
You didn't even notice.
No.
Put a nice little bow tie on it, CJ.
The bow tie question type can be tricky. It can be a little bit tricky, especially, again, if you have not practiced these. So that's why I love what we do here at Hurst Review. We make sure students are exposed to every question type. But the bow tie question will have you consider multiple things, and it will have you do multiple things. And so first, they may make you choose what the actual problem the client is having or what the most pressing problem is. And that goes in the middle. Okay, so with the bow tie, we're going to start it differently. Instead of working from left to right, you're going to start in the middle. And then you're going to go out to the sides of the bow tie to answer the rest of the question. So whatever you put in the middle, the answers for the outside flow from the answer that's in the middle.
In the middle. So we're starting at the core for everything.
Yes.
And
Yes.
then it branches out.
That's right. And so if you get the middle wrong,
Wah, wah,
Yeah.
you're going to get the
you're
outsides
going to get the
wrong.
outsides wrong. Because if the middle's not right, you're going to end up choosing whatever goes on the outside based off of what you put in the middle.
And we already know the middle's wrong.
And it's right. If the middle's wrong, the outsides are going to be wrong. So first, get that middle right.
Focus on the
Focus
middle.
on the middle. Okay, and so then outsides could be things like interventions that you will perform or signs and symptoms that you will watch for. And so you got to make sure that you choose that middle right, so that way you can get the outsides right.
And no partial credit. If you get the middle right, but one of the two outsides wrong,
Right.
This is not a partial credit situation.
Well, it could be. It could be a partial credit.
This could be a partial credit situation.
It could, because if they get the middle right, they could either get the outsides right or wrong. If the middle's right, they get credit for the middle being right.
Oh.
And then the outside, just depends. But if they get the middle wrong, most likely they've gotten the outsides wrong too. And so there wouldn't be any partial credit. So they didn't get any piece of the question right, none.
So that was bow tie. And the last one leads to the very beginning where we're talking about the trends.
That's right.
Yeah, that little ding, chocolate chip, ding, brownies, ding. We are talking about NCLEX question type clinical judgment trend.
Yep. And so this one is basically you're following something about the client that has trended over time. And so with this, it could be you're looking at a set of vital signs, and maybe they gave you the client's vital signs at multiple hours. You are comparing that data from 1 hour to the next. And so maybe you're looking to see, is the blood pressure trending up? Or is the temperature trending up? Or where is the main issue? Like, do I have a big issue with the pulse from this hour to this hour? Out of the vital signs that they've given me, which one scares me the most? And so you could be looking at multiple things. And it's not just vital signs. It could be anything about the client that could trend over time. Urinary output, watching an IV flow sheet, watching the amounts, where the client gets their IV fluids. So it's any information about the client that gives you multiple pieces of data over time.
Formed around, of course, a question.
Yep.
Whew. Okay, Ashley, we covered all three categories. That's a lot.
It is a lot.
It's a lot to unpack,
Yep.
but I think it's beneficial because nobody likes going in blind
No.
or, expecting some surprises.
That's right.
So there you have it. We have three categories. Under each category of question are different question types.
Yep.
We reviewed good strategies, tips, tricks, but I think the common theme that we kept coming back to is knowing your core content.
Yep.
And taking each question like it applies to that final score. As always, Ashley, we have a lot of resources that we offer to our students. We know that you want more. You want the rationales. You want to be able to practice. You want to be able to use the calculator feature and practice this in the questions and do the drag and drop and fill in those actual blanks. Good news. We have it for you. You'll be able to access those all of those question types with any of our Hurst full review products. So that's going to be our Hurst Now, which is on demand, Hurst Endstream, which is live via Zoom and virtual, and Hurst Live, which is in person in the classroom with a 9-month access to your student account, applies to those last two. QBank, practice test, readiness exams, rationales, all of those question types are included on it. You'll be able to experience some of those question types through our free trial and also some through our social media channels. All of that can be found at Hurst Review on social or hurstreview.com on the web. You know what we're going to do right after we stop recording here?
What?
We're going to make our own ding video where we're going to lay out all these different question types, and then we're going to see what Ashley wakes up to. In order to see that, check out that on our social media channels. Chocolate chip cookies. Select all that apply. Case study. Bow tie. We lost her, y'all. I think that's a wrap for today's episode. Until next time, future nurses,
Current nurses,
and retired nurses, thanks for tuning in to the Nursing Navigator by Hurst Review.
Guiding you through from school to the floor, nursing news, careers, and so much more. Learning, growing, passing the test. With Nursing Navigator, you'll be your best. Nursing Navigator's here.